Hey you and welcome. My name is Guy, and in this video we're going to look at the part of our cancer stat service that tracks all information to do with cancer drugs, treatments, and clinical trials. As you can see, we're already on the page which is of relevance. And if we just have a quick look on the left-hand side here, on the left-hand side navigation, you can see it says drugs, treatments, and trials. There's a list of around 20 drugs, treatments, and trials there, and then it says see all 1,931. Looking across here, you can then see that the drugs, treatments, and trials have been listed alphabetically. And if we're on the letter A at the moment, if we just have a quick look here, this shows you all of the drugs, treatments, and trials beginning with the letter A that we are tracking information on. So it's very, very extensive, as you can see. Where we have the little red logo here, it means there's been a news article in the last 24 hours on that particular drug. Right, what we'll do is we'll show you an example of one of them. So if I just type in here, Keytruda, and if I click on that, there we have it, you see. What we now have here is all news articles, starting with the most recent, where Keytruda has been mentioned. Okay, so if we scroll down, we have 30 articles on each page. And you click on the headline in order to view the article. Below the headline, you have the source, the date and the time, and how relevant the article is to the subject, which in this case is a drug in question. So 5% with this one here, it's obviously low percentage. Next one is 100%, as you can see. And then if we just have a little bit look further down, 59%, 7%, 100%, and so on. Okay, scrolling down gives you an idea of some of the sources that we have tracking information on this particular drug. We go back up. What we also have here is we have the archived boxes, and this shows you the saved copy of the news article. So if ever a news article is removed, it's very rare that happens, there's always a copy of it here in the archived box. So here we have latest news. We have the top 100 links to email subs. If I just click on the email subs here, this is where you can switch yourself on for a daily email for any drugs which are of particular interest to you. This has already been switched on, as you can see. In order to switch, for example, if you want to switch it off, you just untick it here, press the submit button, and now it's switched off. Likewise, if you want to switch it on, you go back to email subs, you put a tick in the box and press the save button. And you can receive daily emails or email alerts on as many drugs, treatments, or clinical trials as you wish. Next to email subs, we have the top 100 links. If we click on that, again, it's the same layout for every single drug, treatment, and trial that we track information on. You have the top 100 links and the email subs. But if we just scroll down here, we can see the top linked 50 companies that have been mentioned with this drug and the top linked drugs that have been mentioned along with this drug throughout our intelligence platform across all sources worldwide. So if we just scroll down here, large number of the drugs here you can see mentioned, and then the number of articles that have been mentioned with Keytruda, and also company-wise as well. You can click on any of these and see the most up-to-date information on them. So it really, really, really is a very, very extensive service, as you can see. We're continually adding new drugs and new companies to the platform, and also a lot of those actually are being requested by clients of ours, and you're able to do that as well. You can ask for drugs to be added. That's pretty much it for the moment. All that's left is for me to thank you for watching. We really appreciate it, and we will see you, as always, really soon in the next video. In the meantime, take care of yourselves. Guy out.